క్షత్రియ బేరి ప్రత్యేక కార్యక్రమానికి స్వాగతం సుస్వాగతం. ప్రాణానికి పేద ధనవంతుల భేదం లేదని చూపుతూ అత్యవసర పరిస్థితుల్లో అందించాల్సిన అన్ని చికిత్సలను ఒకే చోట చేరిస్తే ఆరిలోవా అపోలో హెల్త్ సిటీలా ఉంటుంది. ట్రామా కేసుల్లో అతి సంక్లిష్ట పరిస్థితులను కూడా సునిశితంగా పరిశీలిస్తూ క్షణం క్షణం రోగులను కంటికి రెప్పలా కాపాడుతూ విశాఖ పరిసర ప్రాంతాల ప్రజలకు సేవలందిస్తున్న అపోలో హాస్పిటల్స్ గురించి మనకు కార్పొరేట్ ఆసుపత్రిగా మాత్రమే తెలుసు. కానీ 7 స్టార్ మౌలిక సదుపాయాలను కలిగి ఉండి కూడా 3 స్టార్ ఛార్జీలను వసూలు చేస్తూ ఎన్టీఆర్ వైద్య సేవ ద్వారా తమ సేవా తత్పరతను చాటుతున్న అపోలో సేవలను సీఈఓ సందీప్ చత్రత్ మాటల్లోనే తెలుసుకుందాం రండి. క్షత్రియ భేరితో మాట్లాడుతూ ప్రతి ఒక్కరూ ఆరోగ్య బీమాను కలిగి ఉండాలని సూచిస్తున్న ఆయన సలహాలు సూచనలను ఓసారి చూద్దాం. ఆరోగ్యమే మహాభాగ్యం అనే నానుణ్ణి మనందరికీ బాగా తెలిసిన విషయమే. అయితే ఆ ఆరోగ్యాన్ని మధ్యతరగతి సామాన్య కుటుంబీకులకు కూడా అందిస్తున్నటువంటి ఘనత అపోలో హాస్పిటల్స్కు దక్కింది. అపోలో హాస్పిటల్స్ సీఈఓ సి సందీప్ చత్రథ్ గారి దగ్గర ఉన్నాము. సో అపోలో హాస్పిటల్స్ అందిస్తున్నటువంటి సేవలేంటి, అసలు ఎటువంటి విధానాలు వీళ్ళు అవలంబిస్తున్నారు, టోటల్గా ప్రపంచం మొత్తం కూడా కొన్ని వ్యాధుల బారిన పడుతున్న సందర్భంలో విశాఖలో వీరు అందిస్తున్నటువంటి సేవలేంటి, అంతర్జాతీయ జాతీయ స్థాయి ప్రమాణాలతో నాణ్యత విలువలతో ఆరోగ్య సేవలు అందిస్తున్న అపోలో గురించి కొన్ని విషయాలను మనం ఈరోజు కార్యక్రమంలో తెలుసుకుందాం. ఇంకెందుకు ఆలస్యం, మనం వెల్కమ్ చెప్పేద్దాం. సార్ నమస్తే అండి. సార్ వెల్కమ్ టు క్షత్రియ బేరి న్యూస్ స్పెషల్ ప్రోగ్రామ్. యాక్చువల్లీ టుడే వరల్డ్స్ క్యాన్సర్ డే. వాట్ ఆర్ ద స్టెప్స్ దట్ హ్యాస్ taken by the Apollo to control the world cancer?
Every year 10 lakh new cancer patients are added in our country, and it has become a sort of a epidemic, and cancer control is a comprehensive strategy, and Apollo is working on it in a very big manner. First thing is that about making community aware about cancer. You see, in our country, India is world capital for oral cancers because of pan masala, pan barag and gutka. Very high number of oral cancer patients. And second, about this breast cancer, cervix cancer and lungs cancer, you are all aware because of smoking. So first strategy is to create community awareness, so that people adopt healthy living as a way of lifestyle and don't take things like pan masala, gutka, smoking, which are injurious to health and which results in diseases. So that is the very, very important part. So Apollo works with community in a big way. This year we have got the big award from Rotary also for the outstanding community work. And we try to organize programs, make community aware about the this disease epidemic, and generally also about healthy living, by which diseases like cancer can be reduced. The second thing is about screening. Apollo has a preventive health checkup program, and we have conducted more than 15 million health checkups, the highest in Asia. And annual health checkups help in detecting cancer early. And the problem which we are faced right now is when the cancer is detected, these 10 lakhs patient in a year, it is in 3rd and 4th stage. Then whatever you might treat, you cannot cure. So for cure you need to detect cancer early. That happens with more screening programs, more camps and annual health checkups. So Apollo works on all these three verticals in a very big way. As a matter of fact, we also have a DNA plus program in which we are doing even genetic testing, because a lot of cancer patients are, these diseases are inherited in families. So since they are inherited, so by genetic testing along with your personalized health checkups, we can detect cancer in early stages. The third important part is of technology. Of course, Apollo is known for technology and teams. We have one of the most, I would say, upgraded and the latest technology available in Apollo, and things like immunotherapy. We have latest PET scans. We have latest radiotherapy machines, tomotherapy. So all these help. Technology helps in detecting the disease early. And here at Apollo Hospitals, Visakhapatnam, we have one of the most advanced mammography machine, digital mammography, one of its kind in Andhra Pradesh, and through which we are able to detect breast cancer very early stage, and the radiation which patient is exposed is also very less. And we are giving 50% discount on the occasion of World Cancer Day, and originally it is for 2800 rupees the test, we are giving with 1400, so that people can take advantage and get the breast screening done. And India has very high incidence of breast cancer. Apollo is also bringing first proton to Asia in Chennai. So what I meant is that the technology helps in detecting of disease early, and we have excellent team of doctors. More than 200 cancer specialists are working in Apollo in various hospitals. 8 cancer institutes are there all over the country. So a lot of focus is on technology and team, through which we have a program of precision oncology, in which we target the genetics and the damaged genes, mutation genes, so that cancer can be cured. And we believe that cancer is curable with the help of latest technology and team of doctors. The fourth important vertical of our campaigning is about making more information available to medical professionals, which we organize cancer conclaves. And cancer conclaves are the medium in which workshops are conducted, like recently, day before yesterday, and today also in Hyderabad we are conducting cancer conclave, in which we are able to have deliberation and exchange of knowledge among the medical professionals. So that helps in enriching and again value addition for enhancing our skills to detect and to treat cancer in a better way. Apollo also has the highest number of telemedicine centers in the country. Mainly close to 100 centers are there. And you see, India lives in metros and in the villages, and the technology and the doctors are in metros. So what happens is there is a mismatch. The villagers are not able to have the best treatment which are available in cities. So that we are connecting with telemedicine. And this is a wonderful thing through which we can detect cancer in early stages with the help of telemedicine network. And we believe in tumor board pattern of treatment. Tumor board is a board in which cancer patient is being treated after the collective wisdom of medical oncologists, surgical oncologists, radiation oncologists, all sitting together, hemato-oncologists. They discuss what is the best treatment which the patient should be given, and through the collective wisdom we finalize the best treatment modality for patients. So this is a very, very big vertical on which Apollo works, and I think cancer is something with nearly 82 million people dying every year because of cancer all over the world. This is something we are working very aggressively and treating patients from nearly 120 countries. who come to Apollo because of lesser cost, because of ease, because of better outcomes, and treating them successfully. And we believe cancer is curable with the precision oncology, with the latest diagnostics and the latest technology to treat cancers.
Actually, Apollo got a goodwill of the customers. Actually, they have a trust on you. How it is possible to get that trust, sir? Actually, what are the services that you are provide to the heart patients and general patients come to your organizations?
Hospital started nearly 2 decades back in Visakhapatnam, and earlier we had one hospital at Ramnagar, which was a heart and kidney hospital, and now around 9 months back we started Apollo Health City at Visakhapatnam, Arilova, and it is a super specialty and one of the best infrastructures in the country. And now we are doing all specialties under one roof. And the main highlight is that there was a very big need of trauma care, because accident, emergency, there was a need of a comprehensive trauma care in which surgeons, orthopedics, neurosurgeon, emergency specialists, critical care, plastic surgery all work together to treat patients. And there was a lacuna and absence of advanced ambulance services. This we have fulfilled. We have 1066 GPS enabled ICU on wheels ambulance services. That is a very big advantage, and through which we are able to save life by offering and providing better trauma care services. The second important part is that of the affordability. We have 7-star infrastructure at Health City, but we are charging 3-star only. Even on our general wards, we are charging 1500 rupees, but giving attendant bed, air conditioned environment. Today we are empaneled with Arogyashri in both the hospitals. So there is affordability is also very important. Earlier people were traveling to Hyderabad for super specialty care and spending lot more. Now in your neighborhood itself, super specialty services are available at an affordable cost. We have done liver transplants in Health City, and we have one of the best critical care setups with the bed-to-bed cubicles, which helps in preventing spread of infections, and very good 6 modular operation theaters. These are all the USP with the help of which we are able to provide the latest and best treatment to the patients at affordable cost. Very good department of joint replacement surgeries there now, neurosurgery is there. These are the new things. Apollo is always known for heart and kidney, but both these verticals we have strengthened, consolidated and further added, because we have done more than 1 lakh cardiac procedures in Visakhapatnam with nearly 99% success in cardiology, which is very big achievement. Also, we have done more than 400 kidney transplants in Visakhapatnam. That is again, now recently we did 5 liver transplants in Health City also. So what I want to say is that besides the heart and kidney, now trauma care, critical care, emergency services, very good joint replacement, neurosurgery, there is a focus on overall. We have a full-fledged blood bank. We have a very comprehensive laboratory, fully automated laboratory services, latest MRI, latest CT scan. So in diagnostics also, best facilities are available at Apollo Hospital, Arilova. And our original hospital, Ramnagar, is functioning as before. We are doing lot of cardiac and kidney work there, but we are also doing orthopedics. It is empaneled with Arogyashri for orthopedics and neurosciences, and with EHS for the joint replacements. So that is a daycare center and have a very good critical care services in Ramnagar, Apollo Ramnagar. And Health City we are doing all specialties also, like gastroenterology, liver transplants, We have very good urology laser facilities in Health City. You know, in this part there is a very high occurrence of kidney stones, and nephrology problem is there. Places like Ichapuram where renal diseases are very widespread. So having good urology services was very much required in the city. So we brought one of the latest laser machines at Arilova Health City, and through which we are able to give a very good treatment for urology patients. Recently, Apollo hospitals have been recognized for best community work, not only nationally, internationally by Rotary, and nationally by Pharmacare and various other forums. But our main motto is, as per our chairman, Dr. Pratap C. Reddy, he is the visionary, he is our motivation, that life is priceless. And we must, and we are all working towards live healthy India. And healthcare should be affordable. And we organized lot of camps with the communities in periphery and make health checkups, so that health should be perceived as a necessity. And through your forum, I want to also highlight to common people to definitely take health insurance, because today is the era of roti, kapda, makan and insurance. We have seen that lot of patients come to our hospital, but they don't have the finances for payment, because they have not spent money in taking a good insurance cover, medical insurance. And without medical insurance, spending 3-4 lakhs is tough. So Apollo Munich has a medical insurance company also. So we can take benefit of it, and take benefit of now these best facilities available in healthcare at Arilova Health City. And definitely it is doing very well now. We are having more than 100 patients admitted at our Health City, and it's growing very fast. And I must thank the community for the love, support, and they are also appreciating a great deal that even difficult cases, serious cases, we are able to manage very effectively and very nicely, and the outcomes are better. And that is the highlight, that our hospital is doing exceedingly well with the love and support of all of you.
Sir, actually, NGR patients, NGR Arogya Seva patients and the VIP patients are managed by the here staff very in the same manner. There is no difference between those persons. How it is possible to the corporate hospital Apollo? What you are believing in this?
NTR Arogya Shri Seva is very popular, and we feel that if we have to work towards live healthy India, we have to treat masses as well as classes. Both have to be treated. So for the scheme is there, we want to give the benefit of best international healthcare to common man. And I think NTR Alogeshri Seva gives us this opportunity. And also I have mentioned that since our rates are affordable, if you compare our rates with Hyderabad rates, is 30 to 40% less. And our rates are just like the city nursing home rates. But infrastructure facilities are much, much better. So people are finding it a very, very welcome thing that they are able to take advantage of this treatment at affordable cost, and they don't have to travel far off distances. That is also a very important thing, because if you have to travel far off distances to take health care, the cost goes in hotel stay for the attendants, in traveling. So it is more accessible, available in neighborhood. So with the help of this, we are definitely able to benefit the society at large and work towards health for all. And I must say we have managed to get lot of support, and people who have come to our hospitals have appreciated the environment, the infrastructure, and the services. All patients are given same services without any differentiation of the payment and NTR or cash, or so it's a health for all, which are we are all working towards.
Actually, Apollo have a sufficient and furnished, full-fledged, knowledgeable persons, so doctors or some other staff or the, but they are treating the people with effect. That means effective treatment and effective introduction, effective medication. Everything should be given to them with a proper way. Is it the part of Apollo's training or not?
Apollo, we treat all our patients with tender loving care. We call it TLC, and there is lot of emphasis which goes into training, because for each of our services we have a well defined process through which training and rigorous training is given to our service line managers, to our emergency doctors, to our clinicians, to our support staff. We have a system of voice of customer, in which each patient feedback we capture. We analyze in a deep manner that how we can improve the services, how we can satisfy the patient in the better way, and how we can provide him with the best of health care. So this all feedback comes by listening to patients. So we listen to patients, and according to their needs, try to provide them the best possible health care. This is the funda with which we work, and we work on it in a very aggressive manner, in a very systematic manner, and staff selection is also with lot of focus, so that patients are comfortable, and we try to do lot of competency assessment of staff, and based on their competency give them specific trainings which will benefit them in medium term, short term, and long term.
How is Apollo is differ from other corporate hospitals in the response of surgeries? What are the surgeries that Apollo is providing here?
We are doing advanced kidney transplants. We have done, and I'm very happy to share, successful liver transplants, for weight loss, bariatric surgeries, for urology, lot of kidney stones. We are doing lithotripsy and laser surgeries. We are doing advanced cardiac surgeries, valve disease surgeries, and advanced gastro related surgeries, stomach related problem. It can be from simple appendix, gallbladder, to high-end Whipple's operation. So joint replacement, knee replacement, hip replacement surgeries, polytrauma, complex fractures, we are managing, and advanced neurosurgeries, head injuries, and neurology is also one segment which we are emphasizing a lot. So if you ask about the quality of our services in the surgical side, we are very proud that now we are doing everything at Apollo Hospitals, Visakhapatnam Health City, and the outcomes are also very good, because we track the outcomes, that how the patient gone for surgery, how was the outcome, how was the ultimate response, did we cure the patient, did we improve his outcome. So more than 99% we are giving success in the surgical outcomes. So that is also a very comprehensive system of quality care, Apollo Clinical Excellence Program, through which we monitor the outcomes of surgeries and see how we are in comparison with national and even international standards. And we are faring very well, and even in most of the areas better than the international benchmarks, because there are a lot of good team of doctors which we are having here. And Andhra is very fortunate in that way, that rich talent of doctors and consultants is available. And so with the help of medical community and consultants, we are able to treat difficult diseases also in a better manner and give them favorable outcomes.
Sir, actually we heard one thing. Apollo is taking care of a nutrition food of the patient also. Is it true or not, sir?
Yes, nutrition is a part of our comprehensive treatment. We have a department of dietetics, and we do the nutritional screening of each patient and try to see what sort of diet patient is deficient and is requiring. And based on that, we try to give him the best possible nutrition, because with adequate nutrition, the disease fighting becomes easy and the patient is able to recover from the disease and illness in a better and a faster time period. So it definitely, dietetics is an important part and very critical part of the treatment, and we work with it in a comprehensive manner, and so that we are able to give the patient the best possible treatment.
Sir, actually you had already mentioned this is specified for the trauma care. What are the trauma treatments that you are done here, sir?
A lot of trauma care and complex multiple fractures of lower limb, head injuries, cases of fractures, joint injuries, blunt abdominal injuries, all sort of trauma cases, road traffic accidents, and with the help of our 1066 GPS enabled ICU on wheels ambulance services, patients are able to come to us in the shortest period of time, and this helps in saving life. This helps in saving life, and we have done remarkably well in the trauma care. We have a very good emergency department in which there is even for wash, because lot of industrial accidents take place, burn cases come to us. A separate area is there for the wash of the patient in case of toxic injuries to patient, and there is a very systematic critical care like facilities in the emergency department itself, and that helps a lot in providing a patient with the best possible treatment, because initial golden 1 hour in trauma is the life saving. If we provide best treatment, we are able to have the best outcomes. If we don't provide good treatment in the golden hour, then time is muscle. The heart problem, the muscle gets damaged. In brain injury, the brain is lost. So fast treatment, shortest period of time in a comprehensive team approach makes the difference.
So what is the message that you have to give in to other people from the Apollo hospitals?
The message to people is to live healthy, adopt healthy lifestyle, exercise regularly, adopt as far as possible vegetarian diet, and take care of your body. Go for annual health checkups, because I think this is something which helps in diagnosing disease early. India currently is going through an epidemic of non-communicable diseases. We are world capital for diabetes, world capital for heart disease, world capital for hypertension, and now cancer also. So prevention is better than cure. Adopt healthy living lifestyle. go for annual health checkups, and make health a priority. Go for health insurance. That helps in making super specialty care affordable to you, and in the time of need, it makes very big difference and helps in saving lives.
సామాన్యులైన ధనవంతులైన ఆరోగ్యం ముందు అందరూ ఒకటే అంటూ మనం దేన్నైనా సరే దాన్ని నివారించుకోవడం అనేది ప్రధాన మార్గం అని చెప్తున్నారు. రెగ్యులర్ లైఫ్లో ఎక్సర్సైజెస్ని వాటిని ఒక నిరంతర ప్రక్రియగా మార్చుకుంటూ ఆరోగ్య ఇండియాని స్వాధీనం చేసుకోవాలనే ఒక కాంక్షతో ముందుకెళ్తున్న అపోలో హాస్పిటల్స్ తాలూకా మనోభావాన్ని ఈరోజు తెలుసుకున్నారు కదా. మరో వారం మరొకరి మనోభావాన్ని తెలుసుకునే ప్రయత్నం చేద్దాం. అంటిల్ దెన్, బై బై, సీ యూ.